Hello, everyone, and welcome to another episode of Without Pain Wednesday. This week we have a special episode with a special guest, my wife, the lovely Marina. This is the first time I've had a guest on my stream, so hopefully this all goes well. I'd just like to introduce Marina, and the topic is pregnancy. So I'll have her tell you just a little brief overview of about her pregnancy, and then we'll get into back pain related to pregnancy. So why don't you let them know what how it's been going?
Hey everybody, so I'm 28 weeks pregnant and I have been experiencing a little bit of back pain during my pregnancy, specifically like SI joint pain. So we're going to talk about what has been causing that pain.
All right, so we have a slide prepared, and so we'll go to the slides, and we're going to talk about the hormones that are released during pregnancy, which are primarily responsible for why back pain is so common during pregnancy. So here we go. This is a slide of a graph, and the graph is showing several different hormones and their timeline over the period of the weeks of pregnancy. And we're going to be focusing in specifically on this hormone called relaxin, and that is represented by this blue line here. So Marina, can you tell them a little bit about relaxin?
Yeah, absolutely. So relaxin is a hormone that is released mostly during like the 8th and between the 8th and the 12th week of pregnancy, and it loosens your joints and softens the connections in your pelvis so that your pelvis is ready to hold the weight of a baby and then eventually give birth. And so for me, in between weeks 8 and 12 during my first trimester was when I was experiencing the most pain in my back and in my pelvis and my SI joint. And I really noticed that. And Dr. Ryan kind of warned me about it ahead of time. He was talking about how I would experience that and that I should prepare ahead of time. And I was doing my best, but I still definitely felt that pain during 8 and 12 weeks.
Okay, so thank you for sharing. So what we know is if you are pregnant, especially early on in your pregnancy, you can know that this hormone relaxin is going to be released, and we can see the predictable timeline of what happens. And so this does have an impact on your body and your joints, especially your pelvis. As Marina shared, it is preparing your pelvis to give birth, and it does soften and relax all the ligaments in your pelvis, and that's what leads to a very high frequency of sacroiliac joint pain, or SI joint pain. And so Marina shared that she did experience SI joint pain during her pregnancy. So would you say that when you felt the pain, it was during these weeks of weeks 8 to 12, or?
Definitely, yeah. And a little bit after that as well too, kind of, here and there.
Okay, so it's been on and off since.
Mm-hmm.
Are you feeling it right now?
No, not right now. Not in this moment. Probably because I'm standing up straight.
What about in the last week or two?
After a long car ride right before Christmas, through lots of traffic, I definitely felt that SI joint pain.
So we can see that the relaxing does continue throughout the pregnancy. It's just the highest in week 8 through 12, but we can see that it does continue. And so can we share your tips for what you've done that has been helpful, and also just any general tips that you have?
Yeah, absolutely. So I think the biggest thing I would have done differently was to be more proactive about experiencing this SI joint pain with regards to strengthening my glute muscles. So that means like preparing with bridge pose and the butt buster and deadlifts and squats with like some weight. So I would have previously, I would have prepared up to that point. And then also just being aware of symmetry in my body, like not crossing my legs and trying not to spend too much time sitting, because after I was sitting, I could always feel after I stand up that my SI joint was loosened more. So just finding ways to strengthen and tighten that SI joint, the joint where my spine connects to my pelvis. Mm-hmm.
Cool. So we are going to demonstrate the butt buster bridge. I've talked about it in previous streams, especially the SI joint pain stream. So we're going to demonstrate that right here in a minute. And I also wanted to ask about sleeping, since sleeping has been a little bit of an issue for you.
Yeah.
Is that right?
Yeah.
And did you tell everyone how many weeks pregnant you are?
Yeah, 28 weeks.
28 weeks.
In my third trimester.
Okay, so yeah, we're just in the beginning of the third trimester, and sleeping is starting to become more of an issue. And so let's talk a little bit about that. What's been going on with sleeping?
Yeah, so I just feel like every time, sleeping on my back is not possible anymore because of the weight of the baby pushes down on specific arteries.
The abdominal aorta, so
yes.
it blocks the blood flow to her and the baby.
Yeah, and so I can't sleep on my back. So I have to sleep on my side. My left side is the best side for pregnant women to sleep on for digestion and circulation to the baby. But then eventually my shoulder gets tired and my hip gets tired a little bit of sleeping, that many hours. So I have to actually wake up in order to change sides, because I have to do it so consciously and then get comfortable. And then I have to sleep on this side for a little bit with a pillow in between my legs. So it's just that constant switching back and forth between the night, and then also getting up to go to the bathroom so many times during the night is never.
So you've had some issues with sleeping on your side?
Yeah, a little bit, yeah.
What are those?
Well, like I just said, my shoulder and my hip.
Okay.
Yeah.
So your hip gets tired. What, you mentioned your shoulder. What actually happens to your shoulder?
It's just getting compressed down. And so you've taught me actually the 3/4 position that's helped me to, it's like a pillow is, we're going to demonstrate it in a minute, but a pillow is wedged between my back, and then I can kind of lean back on the wedge pillow a little bit, and then my shoulders are a little bit straighter, but I'm not totally sleeping on my back. I'm still partially on my side.
Yeah, so we'll demonstrate that as well. So those are the two things we're going to demonstrate right about now. And what I was trying to get at with the shoulder is that she actually has been mentioning that she feels shoulder pain after a while of sleeping on her shoulder. So, and that is common. That's true for anyone that sleeps on their side too much. It is kind of stressful on the rotator cuff and just the shoulder joint, and so it's not ideal to be on your shoulder all night long every night. It actually can lead to some issues over time. And so this 3/4 position that we're going to demonstrate actually seems to be a pretty good middle ground between side sleeping and back sleeping, especially for someone who's pregnant who can't sleep on their back and doesn't want to be on their side all the time. So we'll get right into that. Let's open up the slides here, and I'm just going to move the camera position, and you can go ahead and get into, we'll do the bridge first.
Okay.
So I'm just going to move this if I can. All right, that looks about right. And then I think what I'm going to do is I'm going to switch the microphone to this one. Sorry if that's a... Okay. Sorry if that was a drastic change in volume, but it'll help you guys hear me while I'm over here. So the first thing we're going to do is demonstrate the butt buster bridge. And I do see a couple comments in the chat real quick. Thank you, Sherry and Chris, for the congrats. Yes, it's been an exciting and fun time. All right, so she's in the bridge position, or sometimes I call it the back anchor position. And we're going to kind of skip over all this me instructing her on doing the bridge. As you know, if you're a student in the program, it's very important the way that you initiate the bridge and how much your core is involved. And Marina already knows that stuff. So for the sake of time, we're just going to go. She's going to perform it properly and go up into the bridge. If you don't already know that and you're not in the program, then I can just direct you to the free trial, which goes through exactly how to do the bridge, the perfect bridge, as we call it, in a very healthy way for your spine. So go ahead and come on up. Good. And so she has the band around her thighs, and this is what we call the butt buster bridge. So go ahead. And as she's pushing out, what's happening in her pelvis is the opposite. It's getting compressed together. So it actually squeezes the sacroiliac joints. I don't know how well you can see this, but those two joints, it squeezes them together. The glutes are responsible for that, and it's been pretty effective for you.
Yeah, absolutely.
Okay, so that's the butt buster bridge for anyone that doesn't know, and you can actually go ahead and do as many reps as you want. A lot of the program is more about tuning into your body and feeling through the movements and low intensity. This particular exercise, you can actually go kind of hard and get that burn in your glutes, and it's actually you can get up off the ground after doing it and just feel quite a change in just like how your body feels. It can feel better. So that's the butt buster. We're gonna get prepared to show the sleeping position, which I've also talked about in a previous stream, so give me just a minute. Or do you want it?
Either way.
No, let's do no. Easier. Okay. So. All right. So this is a wedge pillow, and this is what we've been using. Sorry, I'll get in the screen. Wedge pillow or a bolster. This is what we've been using for her sometimes for the 3/4 position. So we'll go ahead and place it behind her. And so you don't need to have a wedge. You can actually use a regular pillow. And this is not only for pregnant women. This can be extremely helpful for men and non-pregnant women as well. Just to be able to take a break from sleeping on your shoulder, and for people who aren't that comfortable sleeping on their back. So she's kind of rolled back onto the wedge a little bit, and you can use more pillows if you want. And just get it to the point where you are comfortable. That's the goal, and using as many pillows as you need to be able to do that. So, and she's also got a pillow between her knees, which sometimes I recommend even more than like a thin pillow, like maybe a thick pillow, or even potentially 2 pillows between your knees. And if she did have, can you put that pillow between your knees? Both of them? If she had both pillows between her knees, that would kind of line her up a little more, her hips up a little more. So you can get to the point where you have like a really thick couch pillow or something that will just help your hips stay in alignment with your back. So that's a 3/4 position. She's not really on her shoulder, and she's not really on her back where the baby is pressing on that artery. So you want me to give you a hand up?
Sure.
All right. So that is the demonstration for today. And that's pretty much the presentation. If there's any questions or anything, feel free to comment. And before you go, Marina, we're going to get into the live Q&A portion of the stream as we do every week. But would you mind just sharing any final tips, final thoughts that might help any new pregnant women or maybe pregnant women further along?
Yeah, absolutely. So just listen to your body and make sure the exercises that you're doing to prepare for pregnancy are feeling good for you and your baby. Don't overdo it. Your joints and your muscles are a little bit loose, so just do what feels good for you. And I highly recommend to be proactive about strengthening your glutes ahead of time, and just staying really positive and staying active in your body. So yeah.
Cool.
Yeah.
Thank you so much.
Thank you.
You're a wonderful first guest and the most appropriate one to have. So thank you.
Yeah. Thanks.
Okay. So we're going to go ahead and get into the live Q&A, and I have some questions prepared. Thank you so much, Maria.
Bye.
And so we'll switch gears here. All right. Give me a sec. All right. Gotta get a little reorganized here. Let me know if you can hear me. I've made some switches to the audio. Okay. I think all looks all right. So this is a question from Philip, and actually I just got a reminder on my phone that before we get into that, I want to honor a core balance training student. And we've decided we're going to honor a student every week, someone who has shown just an extra level of participation either in the Student Hub or on the live streams. I think particularly since the Student Hub is new, we want to encourage participation and encourage people, interacting and responding to other students and just welcoming other students. And so we already have chosen somebody for this first week since we launched the Student Hub last Wednesday. And that person is here live on the stream. So Sherry, we have noticed that you've just been such an amazing student and have been supportive in every way of core balance training and welcoming some students in the hub. So congratulations to you, because we want to give you the first ever Student Hub Award, and that is either you can choose a free month in the Coaching Hub, where I do video analysis of the students, or you can get a free month added to your membership. And so that's up to you. If you're still here live, I just want to acknowledge you and honor you for being such a great student. So let us know if you're here live and you have a preference between the Student Hub or an extra month of membership. And if not, we will send you an email as well. So thank you, Sherry. All right, so let's go into the slides now. And we have 10 questions. So each week we are going to do between 5 and 10 questions from the hub. This week we have 10, so we're going to go ahead and get right into them. And this first question is from Philip. He says, I joined CBT because I have a mild scoliosis that causes sciatic pain that radiates to my hip. I've noticed that as I do the exercises, I have become even more aware of the twists and curves of my back. For example, when I'm sitting on a hard surface and do the push away from my sitting bones, I can feel that they are not symmetrical, Has anyone else experienced the feeling of becoming more aware of the asymmetries in your muscles, bones, and joints as you get stronger with the exercises? So I did want to comment on this one, Philip, because I know you're asking the other students, which thank you for doing that and trying to get other people involved. So I still would love to hear from other students if they've experienced this as well. But I wanted to comment on this because I have experienced this. And I've noticed an asymmetry in my sit bones in sitting. Just I can't feel it anymore. I don't feel it right now. But in the past, I remember it felt like one sit bone was forward and one was back. And they just like my pelvis was kind of off kilter. And it bothered me so much that I always felt it when I was driving. And it bothered me so much that this sounds crazy, but I sold my car and I got a new car because I thought it was the seat of my truck. And it wasn't, as I discovered when I got my new truck and started driving it. It was actually my body. And I think this is a great metaphor or analogy for what happens a lot in life with people who are experiencing back pain. The initial tendency is to focus our attention on the external. What is causing my pain? And what I think you can often discover is if you turn your focus inward and ask yourself, what about me is causing the pain? Not the external environment, but what is it in my body or about my body that is causing the pain? Then you might find a solution. And so with the story of my car, I ended up continuing to drive the same car and eventually was able to bring my body more into balance. And I felt that I wasn't feeling that asymmetry anymore. And so the way that you worded your question, Philip, is interesting to me, that you asked if people are becoming more aware of their asymmetries as they become stronger with the exercises. I think what I would say is I became more aware of my asymmetries as I performed these awareness exercises and these new exercises. But as I got stronger with them, I believe the asymmetry is reduced. But that does not happen overnight. That doesn't even happen over a couple nights. That happens over a period of weeks and months. And so I would just encourage you, Philip, that the becoming aware is the very first step. That is like the most important of all. As soon as you can increase your awareness of the differences in your body, front to back, side to side, that's the point at which you can begin to address them. And that's what we do in the program. And, in the beginning of the program is restoring balance front to back. If you look at the skeleton right there, that's front anchors and back anchors, and that you have to restore balance front to back first. And then later in the program, we will address side to side imbalances. And I believe in most cases, pelvis asymmetry is both. You have a kind of a twist effect going on. And so I would encourage you to just continue doing the things that feel good for you and be patient, that you should probably feel improvement in the asymmetries as you go. So we'll move on to the next question. Next one is from Eric. This one is posted in about the hip flexor push away stretch. So I believe this is somewhere in maybe module 4. He says, when doing this, I feel more of a stretch in my glutes on the other side than I do in my hip flexors on the side I'm trying to stretch. It might be stretching my piriformis. Not sure. Is this normal, or am I doing something wrong? So I guess since we are doing a little bit of a demonstration type day, I'm going to get into the position and try to feel what you feel, Eric. So let's do this. And it seems like you're saying that you feel more of a stretch. No, on this side. Okay. More of a stretch right here in your glute than you do on the hip flexor. And I would say that that is more of an indicator that there is some excessive level of tightness in your it would be the side of the glute that you're feeling the stretch. And it is telling about something in your body. It could be your piriformis. It might be that your piriformis is locked up or seized up. But I don't believe that that's normal. So your main question is this normal, or am I doing something wrong? And I think that I don't think it's normal in the sense that I've heard of many other students saying this. Maybe other students in the hub can share whether they've felt this before. But what I can say is you may not be doing something wrong so much as it's just telling of that you have an excessive level of tightness in your glute or your piriformis. It could be the glutes or the piriformis, I would imagine. It also could potentially be, a high hamstring, and that would be less likely so. But if you had an injury to like a high hamstring tendon, you might just be feeling a little bit of stress on that. It's hard to say, but that's my thought. Is it's telling about something in your body, and it doesn't necessarily mean you're doing the stretch wrong. So what that means to me is I would continue to listen to that. I would respond by, if doing the things that make it feel better, and I wouldn't push through anything that seems to irritate it. And as you go through the program over the period of the weeks that you're doing the program, see if you can notice any slight improvement in that, because as we're restoring balance in our body, you would expect that to kind of normalize. So the goal is to feel the stretch in your hip flexors. That's what I would think most people feel. But yeah, it doesn't mean you're doing it wrong if you feel it somewhere else. It's more about what's going on in your body than I think with this stretch than how you're doing it. I noticed that Sherry is still here and commented in the chat. So she says, "Thank you. I'm such a fan because it is so unique and needed in the back pain community. Your encouragement and attentiveness is rare and so appreciated." Thank you, Sherry, so much. So I love to spread the word and help others who may benefit from the work that you guys at CBT do. Shout out to Osti. Yes, huge shout out to my sister, Osti, who has been just a lifesaver. I think I'm going to start calling her the integrator because she kind of does a little bit of everything, and it's been awesome. So shout out to Osti, shout out to Sherry. Sherry, let us know what you prefer, a month in the coaching hub or an extra month to your membership. And we'll go ahead and comp that to your membership. So let's go ahead and go to the next question. We've got 8 more to go. And I'm going to go ahead and get a little more comfortable here. Give me one moment. This is my usual seating position. We had rearranged it for Marina because she's a little shorter than me, and so we had to find she was standing and I was sitting, and we had to find kind of a level that where we were at similar heights. Okay, so let's go to the next question. This is Brandon. Brandon says, "I re-injured my back doing very light squats, 150 pounds, 2 months ago. I sit all day at work, leading to anterior pelvic tilt, which I believe led to the squatting injury. I have very tight psoas muscles, therefore I bought a So Right stretch device. It provides immediate relief, but only for a few minutes. Any other stretches I try, like the bridge, lead to pain at L4, L5 level. Even the marching exercise irritated this area. Okay? I'm not sure what I should do if I can't progress past breathing. I can easily get on the floor and up, but if I irritate the injury, everything tightens back up, making it painful and hard to move. Should I wait a month and try the bridge again? Bug the doctor for an MRI? Push through the pain and do the bridge now? Okay, good questions, Brandon. I'll answer the 3 questions you asked at the end first. So, should I wait a month and try the bridge again? No. Think about it a little bit differently. So, instead of thinking on or off, or instead of thinking it's black or white, think that there's a gray area where you can do the bridge very, very, very subtly. And so you're not fully doing the bridge and you're not taking a month off from the bridge, but you can just find that really subtle level of participation to whatever degree that you can. Maybe that just means laying on the floor and breathing and gently pushing away from your back anchor. That's the initiation of the bridge. And find that threshold that you can tolerate and do that. And over that month that you would be taking off, see if you can push your threshold farther by 1% a day. And you might be able to make 30% of progress. Maybe not. Maybe you'll make only 10%, but that's 10 more percent progress than you would if you took the month off. If this has been going on for 2 months, and it hasn't gotten better, or if maybe it has, that's an indicator to you as well. So does rest help you? Would taking time off help you do the bridge? In most cases, with people with chronic lower back pain, the time off, the time of resting becomes less than beneficial if you go beyond 3 days. It leads to weakness. And so we don't want to cause a flare-up, but we also don't want to do nothing. So we got to find that middle ground, that gray area of participating to the point that you can. To your next question, should you bug the doctor for an MRI? You can if you want. I don't think that'll make a huge difference in your outcomes. We've done a lot of research, and I've done a couple streams on MRIs, correlation with back pain and outcomes, and there's really not a strong correlation with getting an MRI and having an improved outcome of back pain. There is actually a correlation between some fear avoidance behavior that can actually decrease your outcomes and cause you to potentially change the way that you see your body if you see the damage in so much detail. So it's your choice to get an MRI, but I don't think that that's going to be the solution, just based on the research and my personal experience out there. But if you do get the MRI, don't let the outcomes of the imaging scare you. You're the same person, and you can get better. So that's the important thing to know. Last question, push through the pain and do the bridge now. So I kind of already answered that. Yeah, so don't push through the pain, but yes, do the bridge now. Only do the bridge up to the point that you can tolerate, and see if you can just, even if that's 2%, right? See if you can push your threshold to 3% over the next day or a couple days or even the next week, and see if you can just make slight bits of progress by listening to your body and doing it to the point that you can. All right, so hopefully that helps Brandon. And next one is from Leah. Leah says, great to see this student hub. I have a question. When you're doing the bridge with the foam roller, are you starting with the roller at the top of your thoracic spine and then keeping it there? I'm going to review this lesson, but if anyone has any insight, much appreciated. So top of your thoracic spine would be, if we're looking at this guy here, it would be like the top of your shoulders. I think it's a little below that. I think it's not like at the point where the thoracic spine meets the neck. I think it's kind of in between the shoulder blades. If you kind of split the shoulder blades right down the middle, top to bottom, right in the middle, T4. So top third of the thoracic spine, since there's 12. So T4 would be about one third of the way down, if that answers your question. And yeah, you can kind of keep it there. You can kind of move a little, a couple segments down, maybe a couple segments up. But this one is not rolling over your spine. We have a different exercise where we do manipulate each segment over the foam roller. And that's the one where you would go all the way to the top of the thoracic spine and then potentially all the way down to the bottom, one segment at a time. But with the bridge, the purpose is it's a different purpose. Get more excursion, makes the bridge a little easier for some people, and also a little less pressure on the neck, and it helps reduce the participation of the quad muscles. So a lot of benefits to that one on the foam roller. Moving on to the next one from Yevgen. This was also about the perfect bridge. Yevgen says, when I do the bridge, it causes pain on the right side of my lower back, right where my lower back is bothering me. Bulging disc. Okay. I try to tilt my pelvis on purpose from the bottom toward the sky. I notice that the pain subsides if I concentrate on squeezing my glute very hard. The next day, I usually have pain in my lower back that feels like it was left over from the bridge I did the night before. Okay, so Yevgen, I think that definitely you should listen to your body, and if you intuitively feel that you have some extra pain the next day from doing the bridge the night before, then you're probably right. I would trust that instinct, and we're going to have to reflect on how you did the bridge, how intensely you did the bridge, and make some change. So you have the pain on the right side of your back, and you know about a bulging disc that you have there. One of the things that you could try doing is less of the pelvic tilt. You can bring your pubic bone to the sky without it being a pelvic tilt. And so it is going to involve a little bit of a pelvic tilt, but it doesn't have to be maximum. And so the pubic bone can be brought forward with the abdominals, and since they attach to the pubic bone, and it doesn't have to require a maximum glute contraction. Although you do say that the pain subsides if you squeeze your glutes very hard. So that is something to consider. Although usually, in my experience, when people are experiencing pain with the bridge or the back anchor or the front anchor or any exercise, the solution is not to go harder and turn up the intensity. The solution is actually it's usually to turn down the intensity to the level at which you don't feel the pain and work right on that edge, right below the pain. And then, as I usually say, you want to push that threshold of pain tolerance further and further. And that requires a lot of patience. That might take time. It might take weeks to be able to get to the point where you're doing the full bridge without pain. So that's my recommendation to you, is try turning it down, and you might not get that pain the next day that you mentioned. But it might require you to turn down the intensity even lower than you want to, even lower than you're comfortable doing. So, but that is my best advice. Next question is from Joshua, posted in the Student Hub. He says, I have not yet been able to effectively lift my pelvis off the floor fully without with the back anchor progression, or rock my legs without one leg compensating for the other being lifted. And at the same time, I feel like I'm not able to get very far with the perfect bridge due to the same limiting weakness. And trying to get these right takes a lot of effort. So should I repeat module 1 until I can lift my pelvis / breathe well / rock without limited compensation and get into a better bridge? Or should I continue trying to improve while also moving forward in the program? I understand the concepts and just don't have the core strength or endurance to get into these positions. Okay, Joshua, I really appreciate this question because it shows that you have an understanding of our process, of our strategy, that the most important thing is the quality of the movements. It seems like you are focused on getting the quality of the movements right, and your limiting factor is weakness. It's not form. It's not the understanding of the concepts or grasping the idea of what we're doing here. So I actually think it could go either way. It's up to you. I'm going to leave it up to you whether you continue into module 2 and learn the front anchors, which will be more information and potentially could be very helpful to you. If the back anchor is a little bit limited right now, the front anchors might be your strong area and you might be able to do a little more participation. Although, you may risk information overload, and if you're still trying to learn the back anchors and also the front anchors at the same time, it is best to try and kind of focus on one at the same time. You said you learned these back anchors and the module 1 stuff already, so it may just be about building the strength. And so in that sense, I would say if you were to continue to module 2, definitely don't leave the back anchor and module 1 stuff behind. Definitely continue working on it, building that strength. I think this will be the key to unlocking your pain, and that's because usually it's our weakness that we need to focus on. And it seems like we've already found your weakness, and that's partly why I put it in module 1. This is a very common weakness for people. And module 2 is a totally different area, totally different weakness that we try and find. So I don't think it would be wrong to continue and go into module 2 and just see what it's all about, see what you find and see what you feel. And you can always stop there and go back to module 1. But the other thing would be just totally stop at module 1 and redo the module. And as I said, I believe that wouldn't be wrong either. I think it's up to you that a lot of students have had success with doing module 1 multiple times, 2 times, 3 times, because you just pick up more information, you pick up little nuances that you missed before, and you'll get stronger along the way. So I don't think there's a wrong there. The only thing is that you don't leave the module 1 stuff behind and just kind of forget about it. You want to go towards your weakness. You want to target that and keep working on it. So hopefully that helps. And just know that there's no wrong here. You can do what feels right to you, and either way, whatever you choose is going to be the right thing in this context, as long as you continue to strengthen that weakness. So hopefully that helps. The next question is from Elaine, and Elaine says, I have a nagging feeling, hold on, that I might have missed something. So give me just 1 second. Yeah, no, I didn't miss anything. It seems like it's just about the strength. Okay, so next question from Elaine, posted in the Student Hub. She says, "Hi, Dr. P. I'm listening to the walking lesson and wondering what the difference is between the rib flare and pushing away from the upper front anchor." Okay. This is a great question, Elaine. So I'm going to go ahead and stand up, and I'm going to answer this by demonstrating. So the the rib flare implies that your entire rib cage is sticking out. So let's see if I can get far enough away. Okay, let's bring this up a tiny bit. Okay, so the rib flare implies, here's my rib cage, that the entire rib cage is flaring away, moving as one whole unit. But, so there's the rib flare. It's almost hard for me to do these days. Okay, the pushing away from the upper front anchor, you can imagine that the ground is here, pushing on that upper front anchor, holding it down in place. It's anchoring it in place. And then I were to push away from it, only the area above that support point is the area that gets pushed away. So let's try this again. So the ground is here, holding it down, like anchoring my rib cage down. I push away, and the bottom of the rib cage stays down. Okay, so that's the goal. And without the ground there, the only thing that's going to be able to anchor your rib cage down is the abdominals, the rib cage to pubic bone connection. So if there's enough tension here, you can push away. I'll slouch to make it obvious. I can push away, and I have tension here holding my rib cage down, preventing it from going like this. That's the loss of the connection. That's the connection I'm referring to when I talk about connection. And so that's the difference. And I hope that spells it out for you. It's a really good question. I've actually received that question in the past. And I'm kind of bummed that I did all of that with the small screen. But hopefully you can still see what I was doing there. And and yeah, I should have switched to a larger screen so you could see better. But yeah, hopefully that helps, Elaine. And it takes practice. It takes work. It's not easy. And it might take you some weeks to build the strength to be able to anchor your rib cage down. And it might take time just to understand that kind of muscle memory of learning how to do that. And so if you're in that situation, my best recommendation is to get down on the floor and practice that front anchor push away, because that's the best training ground, pun not intended, to be able to get that feeling and develop that motor control to be able to do that. So hopefully that helps, Elaine. We've got 3 more questions. So here we go. This one is from, Elaine, you're here. Great to see. All right. Glad to see you here live. And let me know if you have any follow-up questions to ask about that or anything else, and I'll be happy to answer since you're here live. Okay, so the next is from Hope, posted in the Student Hub. She says, I've been dealing with back problems on and off for 15 years. It started when I was working out with a trainer at the gym doing RDLs, Romanian deadlifts. I went down, and when I came up, I felt that pop, and it hit the ground. My husband had to carry me to the ER. I have an annular tear at L4-5, herniation L3-4. It has never healed. I have been to the PT, chiro, pain management, you name it. The last 2 years, it has been more on than off, and the last 6 months, just debilitating. I really struggle with chronic pain every day. Nothing has ever helped much. I pray this will help me somehow. I've mastered the back anchor and can get my pelvis up a tiny bit, but not much. This program has increased my pain so far. I'm day 7. I'm guessing that could be normal. I pray this will help me get my active life back. Thank you. Thank you, Hope, for sharing. It's good to hear a little bit about your background, and it sounds like it's been quite the journey for you, and I feel for you, and I know a lot of other students do too. This is a common thing that people go through, is this downward spiral of back pain. So I believe that you can get better, and I think the key for you after reading what you wrote is going to be listening to your body. And it sounds like doing the the program so far has been irritating for whatever your condition is. You mentioned herniation and an annular tear. So what you're going to want to do is reduce the intensity of how you're doing whatever the exercises that you're doing. So if it's just the back anchor or the back anchor progression, reduce the intensity and see if that still irritates you. And especially for the bridge as well. So you can just do them at a lower level, say 10% or even down to 1 or 2% effort, and you can still get that connection to your deep abdominal muscles. You can still activate them, you can still feel them and get familiar with them, because that's really what this is all about, is just getting them more involved in your daily life. And it does not take a lot of intensity to do that. In fact, going too much intensity is counterproductive because it brings in the other muscles. So super low intensity, and I would say try module 2, since module 1 seems like it's not, like I mentioned, I believe it was for Joshua. I don't think module 1 is going to be the key for you. It may be module 2 that is the key that's going to unlock your pain. It's a very different module than module 1 in the sense that we're targeting a totally different aspect of core connection. And so I would consider trying module 2 and also keep working on module 1, because it seems like you have some room to grow with the back anchor progression and potentially the bridge. So you want to just go slowly and be patient with that and listen to your body along the way. It may take several weeks for you to make progress with lifting, pushing away to elevate your pelvis. And that's okay, because several weeks is a speck on the timeline of our lives. And so if you can make progress in that amount of time, that's what we want to do. And it's probably going to require turning down the intensity, going at a very low intensity, lower than you want, knowing that you'll still get benefits, and sticking with it and listening to your body, and work right up to that threshold where you feel that threshold is going to cause pain. You want to stay right below that and try and push that threshold out over time, over days and weeks. And that's the progress that you're going for. And try module 2, try the front anchors and see how those feel for you. And then let us know. Give us an update in the student hub and let us know what how it's going for you next week as well. But that's definitely my best advice for you right now. And just stick with it. You've been on a long journey, and there's a bunch of people here who are in a similar boat as you, and are making progress and can give you support and encouragement. So we're here for you, and keep it up. I think there was a post in the chat box from Elaine. Okay, you gotta go, Elaine. I'm glad you got to see your answer, and I'm glad to see that you are feeling results. All right, thanks for letting me know. All right, so we're gonna go to next question from Lewis. Lewis posted in the student hub, I finished week 1 encouraged. However, now I'm feeling sore to the point I'm regressing. Is that normal? Am I doing too much or maybe not correctly? I went over the videos numerous times, so I doubt I'm doing them wrong. Please advise. Thanks, Lewis. So, Lewis, it sounds like to me that you asked, the answer is in your question. Am I doing too much? For some reason, I have a feeling that that's going to be your issue. Particularly because you said you watched the videos numerous times, so good on you. That's definitely what I recommend, and I'm glad and proud of you for doing that. So it sounds like you've got the technique right, the method right, but by far the vast majority of students who are struggling through the beginning portions of the program are doing so because they are treating this like their normal workout routine. And this is very, very different from that. So this is more like meditation. The first two modules of the program are more like meditation on your body and feeling and getting in touch and in tune with those tiny little muscles that support your spine that do not require much effort at all to activate. And if you put too much effort into your exercises, it's counterproductive because it starts activating all the other superficial power muscles in your body, and we don't want to do that. And so I believe that could be very helpful for you if you're getting too sore, to turn down your intensity. If you think that your intensity is, if you think that going down to 50% is enough, I'd say go way, way, way lower, down to 10%, down to 2%, down to 1% intensity. This is the area where I think that people will get the most benefit from this program. And then we can ramp up the intensity later. Once we get that connection to these deep muscles, then we can start ramping it up gradually over time and get to the point where you can get back to your normal workout routine and be able to have the connection to your deep core while doing the things that you actually love doing and want to do. But we got to we got to crawl before we can walk. And these first two modules are crawling. And I think that one of my kind of mantras is, if you think that you're not doing enough, do less. And that's where you should be with your effort. So that's my advice. And I'm also glad to see that you've made some progress. You're feeling encouragement, which is huge. And the soreness might just be from doing too much or too frequently is another thing that people do. But more common is too much intensity. So hopefully that helps for you. And then the last question from Carol is posted in the Student Hub. She says, "Hi there. I've not been able to get all the way back into doing the bridge. I'm having a hard time with my left side. That's my bad side, flaring up badly. When this happens, I'm down for a few days usually. My rib and hip feel like they are hitting on my left side. It's extremely painful. But there's more because the muscle spasms all the way up from there to my head and down to my outside toes on my left side. I'm not able to do anything until this all settles down. It's the whole reason I'm looking for help. I think the breathing so far is okay for me, but the bridge looks like it's going to be out since my left QL muscle always kicks in, taking over for the weaker muscles, and the whole thing gets flared again. I was bedridden for 10 months and can't risk going back to that again. I think there was a guarantee. Is that right?" So no real question about the lessons or the exercises, but I did believe I could just offer a little support and advice to you, Carol, because it seems like you are very aware of your body and that your QL is overcompensating for your other muscles. And this is a very common thing in the chronic lower back pain population. And it's also a very common thing we see in the program. And so the solution for that is, if your QL starts kicking in at, say, 15% effort, then you want to go below that. And the QL is a power muscle. It does a lot of things, but it's big and strong, and it's not right up, right next to the spine, attaching to the spine. It goes from the pelvis to the rib cage, and it sounds like your QL is in spasm. It's very tight. It makes you feel it's pulling so hard that it feels like your rib cage and your pelvis are even touching. So we've got to get that muscle to quiet down. And the best way I know to do that is to provide support for that muscle with the other muscles around that muscle, to get those muscles to turn on and do more of their job, so that the QL can feel safe to let go. I have not found it to be successful to stretch the chronically tight spasmed muscle, because it just tightens right back up after you stretch it. But what I have found successful is to provide more support for that muscle so it can feel safe, and it will gradually let go without even stretching it. is very effective, but the only way to do that is to exercise at such a low intensity level that that muscle does not turn on yet. And the only muscles that turn on are the tiny deep muscles up against your spine that I refer to as the deep core muscles, and the deep abdominal muscles, and those are activated at an incredibly low intensity level. Just by breathing, you can activate those muscles, and so that's what I recommend for you. Maybe 1%, 2%, up to 10% effort, and try and exercise whatever you're doing in the program below that threshold of where you activate that QL, and try and engage those surrounding support muscles. And that should be an effective way to get it to turn down. And yes, if if you complete the program and you have any reason to believe that the program didn't help you, or you're not satisfied, we have a guarantee. So that is true. So just to confirm your question. And that is all the questions for today. So hopefully that helps you, Carol. And we are at about an hour. All right. So perfect stream today. I just want to thank again my wife, Marina, for being a lovely guest, my first guest ever, and helping other pregnant women out there who may be experiencing back pain related to pregnancy. And we will be publishing that beginning of the stream into a YouTube video, which takes several weeks, but we cut out all the stuff where transitions and stuff. And also thank you to Sherry for being our Student Hub Student of the Week. And thank you to my sister. As Sherry brought up, she's been an awesome addition to the team over the last, 6 months already. So thank you, Osti. And that's it. So thanks again for being here, everyone, live or on the replay. If you haven't already, don't forget to hit that like button and support the stream so we can keep producing videos and showing up live to help the people. And feel free to share this with anyone who you know that might benefit from this. If you know someone who's pregnant or newly pregnant, a lot of the information that Marina shared, I believe, can be helpful if you can get ahead of the problem of the relaxin being released in your body that inevitably loosens the ligaments in your pelvis and can often cause SI joint pain. So thanks again, everyone, for being here. And until next time, get down on the floor and connect to your core. Take care, everyone.